A great day. Now we will be talking about four organisms, your Legionella, Listeria, our favorite Mycobacteria, and the Spirochetes. So these are all taken from the rapid review of microbiology and immunology. This is your professor, Dr. Benjamin Cabrera. As first talk of your Legionella pneumophila, this is a gram-negative Coccobacillus, which with positive in silver stain, and it is a facultative intracellular organism. It causes your Legionnaire's disease, which is one of the causes of your atypical pneumonia. Okay. It's also called your Pontiac fever, which is a self-limited febrile illness. The mode of transmission is via aerosols from contaminated water source, no person-to-person spread. So to prevent this infection is through chlorination of water sources. Treatment for this condition would be your erythromycin, other macrolides are your azithromycin and clarithromycins, and your fluoroquinolones. Your Listeria monocytogenes follows. Well, your Listeria monocytogenes is part of the normal flora of many animals. So it is transmitted to humans by ingestion of contaminated food, especially unpasteurized dairy products. It grows in cold, like your ice cream, undercooked meat, and these are, when seen in the microscope, these are small, gram-positive, facultatively intracellular Coccobacillus that does not form spores. It is beta-hemolytic, it is a catalyzed positive bacteria, and it is seen as having tumbling motility at room temperatures. The virulence factor for your Listeria monocytogenes would be intracellular growth, your listerolysine O, which causes cell-to-cell spread, and growth at refrigerator temperatures. Okay. So your Listeria monocytogenes causes listeriosis in adults, and later on it manifests as meningitis and sepsis among the immunocompromised patients. Or otherwise, it causes mild flu illnesses like fever and chills, and with pregnant women, it causes sepsis. For neonates, it causes your neonatal listeriosis, like your granulomatosis infantiseptica, which is a listeriosis that is acquired transplacentally in utero. It causes disseminated abscesses and granulomas in multiple organs. It has high mortality rate unless promptly treated and promptly diagnosed. Late onset of the disease is acquired for soon after birth by contact with contaminated body fluids of an infected mother. Onset of the late onset disease would be 2 to 3 weeks after birth and manifests as meningitis and sepsis. Treatment, fortunately for this infection, is quite simple. It's just ampicillin for all listerial infections. Next is our favorite Mycobacteria. Okay, so this is a table that presents the different types of species of your Mycobacteria, your leprae and your tuberculosis. Now let's first talk about the leprae. Okay, so your leprae has two types, your tuberculosis and your lepromatous leprosy. Your tuberculoid leprosy will uh, manifest as few skin lesions with few bacilli, which is compared to your lepromatous leprosy, which has numerous skin lesions with many bacilli And in here, there is tissue damage and loss of sensation. So the Protomotus leprosy will be the one that damages, that disfigures. Okay. So your Mycobacterium leprae will be seen as an acid-fast bacilli, which are obligate intracellular positive organism. It is positive when you do a lepromin test. Okay, it infects cool tissues like the nose. That's why for lepromatous leprosy, it will eat the nose. You can identify it by your phenolic glycolipids, okay, through your Th1 response for tuberculoid form, while your Th2 response will be seen in your lepromatous form. It is acquired through direct contact with lesions or inhalation of infectious droplet. So how do we treat and prevent tuberculoid form? Will be treated with dapsone and rifampin for 6 months, while your lepromatous form will be treated with a longer period and more drugs like your dapsone, rifampin, and clofazimine for 2 years. Now for your Mycobacterium tuberculosis, okay, it can infect all age group, okay, but your children and elderly and immunocompromised are the ones that have greater risk. So these are this is an acid fast bacilli, which is a facultative intracellular bacilli. It shows positive purified tuberculin skin test using a purified protein derivative reagent. How do we identify it? The cord factor, okay, the positive cord factor, there's the presence of mycolic acid, intracellular growth, it will be inside the cell and causes granuloma and caseation necrosis. Pathogenic factors, how do we get it? Through respiratory droplets from coughing person, okay, infected person. So we can give your isoniazid preventive therapy, okay, or by administration of your BCG, which protects us from 60%, 40% from the pulmonary type, but 60% from extrapulmonary type. So we treat Mycobacterium tuberculosis by 4-drug therapy now, okay, for 6 to 9 months. It will depend on the severity and the each country will be treating tuberculosis. But in the Philippines, we treat it as 2-HRE, okay, and 4-HR for mild, but for severe cases, you treat it as 2-HRZE. So it's now a 5-drug therapy and 2-HR, 4-HR. Then, and the last organism would be your Mycobacterium avium intracellular complex, or your MAC. So this is not apple. It is a MAC, your Mycobacterium avium intracellular complex. It causes disseminated infection among those suffering from HIV/AIDS and other immunocompromised individual. It has the same characteristic. It's an acid-fed bacilli, obligate intracellular organism, like your Mycobacterium tuberculosis, but it's even more of an opportunistic infection. Okay, we acquire it through respiratory droplet. So treatment for this one would be azithromycin or clarithromycin plus ethambutol and rifabutin. It is not treated with isoniazid. And the last organism would be your spirochetes. So your spirochetes, the classic example of which will be your Treponema pallidum. It causes syphilis, and it has 3 degrees of infection. The first degree would be it manifests as painless skin ulcers like chancres and buboes. If left untreated, it becomes a second degree syphilis, which will manifest like flu-like syndrome with a disseminated rash. And third degree syphilis can present with gumas, aortitis, and CNS infection. Babies can also acquire syphilis intrauterine, producing a congenital syphilis with a triad, Hutchinson's teeth or unusual teeth, deafness, and interstitial keratitis. So how do you identify it? This is seen spirochetes are visualized through dark field microscopy, or we can do immunologic tests like your PDRL or your RPR tests for cardiolipin, your FDA-ABS test for your treponemal antibodies. Okay, so identify your hyaluronidase causes your tissue invasion. It has a protective outer coat and it induces host response. So how do you acquire it? It's a sexually transmitted infection. It can also be vertical, transplacental, transfusion, and transfusion of contaminated blood. Fortunately, the treatment for syphilis or Treponema pallidum infection is quite cheap. It is penicillin. So that's it. So we've tackled a very short lecture now. So don't forget to uh, click and subscribe, okay, to my channel. Please share my video. Click the thumbs up and your notification button. So wait again for my other lectures. Have a great day.